Hey everybody, Dr. Eric Herman, Guru Chiropractor. I'm here again with another new patient. Oh, by the way, peace and love and God bless to everybody out there. This is my newest patient, Big Kyle. Give me some of that. Big Kyle came from, what did you drive from North Jersey? What's that, about 45 minutes?
45 minutes, yeah.
Well, I appreciate you taking a ride because that's longer than the average ride to the average chiropractor. Gotcha. So thank you. I'm going to do everything I can to make it worth the trip. Kyle's already was a ring dinger guy. He was already found out about the ring dinger. And then I guess you just did some research to see if there's somebody closer to you, and you found me, right?
To get the official ring dinger here in New Jersey.
Gotcha. So that's how he found me, and now he's here. We already did the exam. Not big time stuff going on. And we were talking a little bit off camera. I was giving him props because he doesn't have any pain. He doesn't have, right? Zero pain. Yeah. Just feels like a general sense that things are jammed up and tighter and locked up tighter than normal. And you're getting that sort of ongoing urge to try to pop yourself, that nagging urge, right? And we talked about it. That's one of the things that I teach my patients as far as characteristics or signs that kind of cue them in that they need another adjustment. When you feel that urge to like get that thing released and stretch and pop it on your own, that basically means you need an adjustment. And most of the time, if you pop it, people get relief. But guess what? Most of the time, it comes right back because it's really impossible to adjust yourself. We were talking a little bit also off camera. I'm an expert. I've been in this business doing this, full time for 26 years, and I can't adjust myself. You need a second pair of hands to get in there and get that right leverage to get the release. So for temporary relief, popping, I don't go crazy if some chiropractors will yell at their patients for trying to self-correct. I just let them know to try not to whip around and wrench anything or rip any soft tissue. But if you got to do it, you got to do it. But just know that it ain't really fixing the main underlying problem. If you really need to get it released, you need to come to somebody like me, right? So, but a lot of tightness in the upper, mostly neck and upper back and between the shoulder blades.
Yep.
We did the exam. He does have some abnormal tension in the lower back too, so we're going to release that while you're here too. You're not too aware of that, and that's another good point. Just because you think you feel okay is not a guarantee that everything's perfect. And the best time to handle this really is when, like this, before it gets really bad, to kind of stay in front of the major symptoms and the major pain, because once it gets there, it's a lot more severe, and that could cause permanent damage that accelerates the arthritic degenerative process in the spine, meaning your body wears out a lot quicker, and then that can turn into permanent damage. So if you take care of yourself like this guy's doing it, kind of staying in front of it when it just gets really tight, your body will last longer and won't wear out as quickly. And probability of big problems goes down. It's not a guarantee it'll never happen, but probability goes way down. All right, so I'm talking too much. Now we're going to roll into a good adjustment. You ready?
Yeah, I'm ready.
You excited? Yeah, are you nervous at all or no?
No.
You don't look nervous. No. All right, cool. Go face down on the table for me. So put your, like you were laying before, put your face where the paper is. Okay, so now what we're going to do first is I'm going to just do a little stretch and massage to kind of warm up the muscles and get you ready for the big releases, okay? So your job, again, just stay relaxed as best you can and give me a heads up if you don't like anything I'm doing, all right? We'll talk about it. I do a massage and a release, couple, 2-3 minutes, 5 minutes at the most, on just about every patient that I see, and I've been doing that for years. Not all chiropractors do that. My reasoning is I just want to loosen up some of that soft tissue tension so we get a better and a deeper release in the joint. It's like a warm-up, you want to warm up before you work out. So I warm up my patients before we do the big adjusting. Nobody ever complains. So don't you be the first one to do it. No, it's just I could tell you still work out, though. You're still working out, right? You were talking off, just not doing the big heavy squats and the deadlifts anymore. Yeah, I don't know. It's a great exercise, for your legs, and the deadlift's just great for the whole posterior chain. But it comes with a high risk. Biggest injuries happen from deadlifts and squats.
Yep, that is true.
Back injuries, I get them all day long. Good. Just getting some more blood flowing, softening up the muscle, the soft tissue a little bit. And most people say they like it. It feels good anyway, so what the hell? It just adds to the good customer experience. Once in a while, somebody says, I don't like it. Or if I get too far up to the neck, they're like, I can't handle it, it's too intense.
It is intense, but a good intense.
Sometimes I say, that's probably because you got a screw loose up there. Tongue in cheek, you know, I say it with it like joking, and then all of a sudden they don't say anything, and I get nervous. I'm like, oh boy, did they take that the wrong way? Did I cross that line? Good. All right, good little warm up for you, sir. When you're ready, no rush. Take your time. Come up on your feet. And we're going in the back room where all the magic happens. New Jersey ring dinger style. Come on in. Go that way. Okay. Now what you do here, I know you watched a bunch of videos. You're going to lay down on your back. Head here, face up. So go ahead and get down on here. Head here, laying on your back. Good. Keep your hands up top. Now I got to feel the top of your hips, which is the iliac crest, slide down like 3-4 inches towards your feet. Keep going. A little teeny bit more. Right there. Perfect. Now the table raises up. It won't bother you. I'm just letting you know. Okay. And then the table's also going to lift up your knees, so you bend up like this. Just let the table do the job. Try not to wiggle. Should bring you right up there. And if you notice what this feels like as it goes up, it flattens out the curve in your lower back and relaxes it. Because normally the curve in your lower back goes up around the rainbow. It's the same thing as your neck. Neck and lower back are like this, and middle back is like this, right? But what this does is it flattens it so that the vertebrae now stack like dominoes, not like up around a rainbow. So when we pull, it's easier to release the disc. Bend it and so it's actually genius. Now I gotta pin you in very tight here above those hips because I gotta anchor you down. So when I pull, I don't want you to budge. So, and you know mechanics, so you understand physics, right?
Yes,
physics.
Understood.
So if you don't move and I give some force down there, the only where that force goes is down the spine. Boom. Yep. And that's what lets it get all the way to the bottom, and you get a full spine release just about every time. Which makes the ring dinger the most legit decompression treatment on the planet, in my opinion. Let's see, can you handle this, or is that too much?
I can do it.
Good man. All right. Good. Hands back to me for a second. I just want to make sure there's no play between the hips and the pins. Yeah, you're pinned. Oh, got the wrist.
Yeah,
No extra charge. All right, so the towel now goes around your neck, but really it's grabbing the back of your skull and your jaw like this. But my hands are too small to get a good enough grip, so the towel gives me a better grip. I'm explaining because you're a newbie, and for the camera. And we spritz it because it gives better grip so I don't slip. Lift up, lift forward. Okay, come down. Okay, your job, I know you watch videos, so you probably know this, but keep your teeth together. But don't bite hard, just gently touching closed. And then keep your body as relaxed as you can. Breathe in and out through your nose, and I'll do the rest. You ready?
Yes, sir.
Okay, let me get a good grip. Stay loose as a goose, baby. Deep breath in through your nose, out through your nose, relax, and boom.
Oh my.
Woo, baby.
Whoa. That was it.
Yep. All the way down?
Holy Hannah, yes.
Yeah.
That was wild.
Yep. Just by the patient's reaction, I could tell it was a good one. Now, some people stay silent, and I'm like, hello? I'm like, hello? Those people make me nervous, but with the people that react, any pain?
No.
Good. It's important to let the people out there know that. Very rarely does this hurt.
No.
Only if you're so inflamed to begin with. Like I got guys very severe, acute pain with any movement. They're screaming. If they're on this table and I pull, yeah, it's gonna hurt. But usually it hurts quick, and then the relief comes.
Yeah, I could feel all that tension releasing right now, like in my upper back where we're having that conflicted area. That's like the first thing I noticed right there immediately. So
Yeah,
it's
baby.
like the hot zone.
You just got released. This is not.
Wow.
I'm not saying this is 100% true, but could be high probability. Literally, decades of stuckness could have just got pulled out with one pull.
Yeah.
All right, now I want to do a little more release in the neck. We'll twist this way and this way, and then we're going to get you up on your feet, see how you feel. So stay relaxed. Let me see. Loose as a goose. Good. Drop it in my hands. Drop. Nice. Very nice. Good. Let's see. Look how further you're turning. See your nose is by your shoulder there? Yeah. So you definitely got better rotational range of motion. All right, big man, you're done here. So come on up on your feet when you're ready. No, don't rush it. Okay. Now stop for a second. Check in with your body. Tell me in the camera what you feel like, what feels different now compared to before. Can you tell anything?
Before, yeah, it's all that compression and stuff you're feeling all the time, but now it's like, I don't know, I just feel normal.
Yeah. Your shoulders are back further. Your head's back further. I'm just evaluating real quick when I'm looking at your posture.
I think I'm taller.
And you could be because the compression will shrink you down.
Yeah.
Good job, dude. Good job. All right. So you remember when I bent up your knees the first time?
Yes.
And you said it was pulling a little bit?
Yep.
I'm going to do it again. You tell me if it feels the same or reduced. Okay. Or sometimes it's all gone all the way.
Wow. Yeah, I don't feel it in my back.
Zero pull now?
0 in my back.
Amen, brother. So you're in the rare category. It does happen. Most people, it goes from something to reduced, and occasionally it goes from something to nothing. So that's a great response. It makes me happy for you. Come down a little bit more. Now we're going to do what's called the drop technique or the Thompson technique. By the way, ready for this? I'll tell you an interesting story since you're a mechanical engineer. This technique where it pops up and you do the push down was invented by a guy in the I don't know the exact date, I'm estimating, but early 1900s, maybe 30s or 40s. He had a really bad back injury to the point where he was pretty much an invalid. And the regular medicine back then, nothing helped him at all. There was they basically gave up hope. They weren't even doing back surgeries back then, right? So they basically said you're basically going to be paralyzed for the rest of your life. He wasn't 100% paralyzed, but he just couldn't walk well, and he went to a chiropractor, couple visits, got him back to normal, and that inspired him to become a chiropractor. And then when he became a chiropractor, he used his mechanical engineering skills to create this technique to make the adjustment more effective and easier on the doctor. And then he put a patent on it, and he became the richest chiropractor in the world, not from treating patients, but from inventing this technique. Yeah, Clay Thompson, look it up. All right, so now we're going to do some Thompson techniques. Stay relaxed. Good. This is going to release even deeper. And then some of the joints don't get released on the ring dinger, like the peripheral joints. We're going to do all that on this table. And when you put it all together, it creates an amazing outcome for patients, for people, gives you a big, deep release, and you get all the great benefits of that. Good. A little bit more here. Nice. Now we're going to go up the lumbar spine a little bit. Stay relaxed. Good. This is called a P to A adjustment. Posterior, which is back, going anterior to the front. P to A. Good. Nice. Boom. Bingo. Big release right there. Weren't you telling me this is where the main area you're feeling the tension? Good. All right. Now let's see if those SI joints are more mobile. So remember, lift this one again as high as you can. No, whew, it went up higher in my visual determination. Did it feel like it was pulling less? Remember you told me it was pulling, made it tighter here when you lifted last time?
I can still feel it a little bit, but it is released a bit.
If it's reduced, that's what I'm looking for, yes?
Yeah, reduced.
Amen. And you definitely got more mobility. Do this side. Good. And down. How about that? How did that feel?
Same thing. I feel like I got a little more mobility out of that side, actually.
More so here than here. Yeah. All right. Good. we don't look for perfection, especially from one treatment, but we definitely look for progress. I am results driven. Coming down a little bit. Come down a little bit more. In my practice, I'm results driven. Some chiropractors are driven by other things, but that's what I focus on, getting you results and giving great customer service. And I know if I do that and I can get it done, the rest follows, like the money and more patients and more referrals and stuff. So I get off on making you feel better.
Whoa.
without getting too, look up, without sounding too creepy. Good. Coming around the other side. No, I am, sorry. Okay, look up a little bit. Tilt, stretch. There you go, that was a good release. Nice. Okay, big guy, you're doing great. Now I want you to roll over on your back, face up for me. Yep. We're gonna work on the collarbones and the rib cage. So slide down another couple inches towards your feet. A little bit more. Right there. One more wiggle down. Okay, good. Let me extend the legs. So take your arms, bring them out like a T. Now we're going to work on the collarbones where they attach to the shoulder and then where they attach to the sternum, the chest plate, and then release a little bit in the ribs. All you got to do is stay relaxed. Good. Go this way. Nice. The other that way. Good. Central. Neutral. Good. Good. A little looser. Good. All right. Rest your hands wherever they're comfortable. Slide up a little bit back towards that way. Okay. Now remind me, which was the ankle that you had splinted up? Right ankle? Oh yeah, we didn't tell the camera, but he had, how long ago? 2 months?
Yeah, this
February?
is the first week of February, so coming up on 3 months.
Had a bad sprain in this ankle. It still felt, it's not really hurting, but it feels like it's not as loose as it should be. It's tight and jammed.
Up, yeah.
And I told him it should be safe to treat, and we're going to try to mobilize it to get some things more unjammed in here. Anything sore when I'm poking around?
It's more so like on the upper part of the ankle.
Here?
Yeah. In that area.
When I push in, is it tender or no?
Yeah.
Yeah, compared to this side?
Yeah, on the right side is fine.
Yeah, so there's still a little irritation, but that's usually it's not from the original injury. That all stuff would be healed by now. It's from, it keeps re-injuring because it's not lined up properly, and then every time you use it and move it, any mechanism, I say this a lot on my videos, but I'll tell you too, and you know this, you're a mechanical engineer, so you confirm or deny. Any mechanism that has moving parts that's under abnormal tension and not lined up properly, but keeps moving, what happens? Friction, wear and tear speeds up, right? Friction happens, more heat, and in the human body, friction equates to inflammation and pain, and performance goes where? Up or down?
Down.
Bingo, same thing with the human body, right? So because it's not mobilized properly, and you keep walking on it, you keep re-irritating it. So we're going to get rid of, to the best of our ability, some of that jamming in there, and then it'll allow it to not keep re-injuring and hopefully heal to a higher level, and you get better function. So just drop it in my hands, stay loose, stay relaxed. Nice. Pretty good. Now we're going to pull at the knee. So you got to just give me a loose floppy leg. We're going to mobilize the knee. Nice. Slide back up. Slide back up. Now we're going to do the toes a little bit. Good. One more pull here. Stay relaxed. Drop it. Let it go. There it goes. Now I got the arch a little bit too. Yeah, slide up a little bit more. Now we're going to do the same thing on the other side. Good. I'll do the knee first. Drop it in my hands. Stay loose. Woo! Big knee release. Slide up. Drop it. We're going to just relax, heavy, loose. Good. Just do a little mobilization. Now, I don't know. Does it feel looser at all?
Yeah.
Good. Awesome. Okay. Good. When you get some weight on it, when you get standing, then you tell me if it feels different. We're lowering the table. Wrong way. All right. Sit up when you're ready if you need help. Swing around face that way. We're going full circle. Full circle. Back to where we started. So, the neck, as I palpate it, the muscles feel looser. To me. How does it feel to you? Move around a little bit.
Yeah, it does feel looser.
Good. Let's see. Turn this way. Feel like it's getting better rotation?
Yeah.
Looks like it is. I don't measure specifics. That's still a little tight.
Yeah.
Okay. Again, we don't expect perfection with one visit, but progress, yes. Go backwards. Does that feel less jamming?
Yeah.
Or you sure? Don't lie on for the camera.
If you go all the way back,
Yeah.
then that's when you start to feel it. But I mean, it does.
It goes further without jamming.
Yeah.
Good. That's progress. Forward head posture. Yeah, it's about a 1/4 inch. So it was only a half. What did I say? It was an inch?
Yeah, you're
I
saying.
wrote it.
Yeah, I think an inch and a half.
Inch and a half.
Yeah, it was pretty bad.
My memory sucks. But now, swear to God, it's about a 1/4 inch.
Wow.
That's very significant. Look, that's perfect. So that's less pull than before, right?
Oh,
And
yeah.
less has to go back. That's perfect right there. Only minimal.
Yeah. When you did that initially, it was like it felt really awkward. Now it didn't feel too bad.
Yeah. Still carrying a little pattern of tightness here on this right side. I'm going to do a little bit more with the massager. And then we're going to finish off with the shoulder, elbow, and the wrist. And we'll be done for today. If this is too much, let me know. Just a little bit more for the miss. Okay, now we're gonna adjust the shoulder ball and socket, the elbows, the wrists, the fingers, and we'll be done for today.
Awesome.
So start on this side, bend up in front, just this side. I gotta hug around you, get underneath your elbow, stay loose as a goose. Relax it, relax. Good. Give me this side. Same thing, bend, elbow down to the floor. Relax. Good. Coming around. Little mobilization in the joint in the elbow. Drop it in my hands. Everybody get guards up for the elbow. Good, floppy. Now a little wrist. Good. Nice. Now pull towards you, pull. Good. Got what's called the saddle joint. Sometimes it even gets more of the elbow. All right, drop it in my hands. Stay loose. Nothing too bad in the elbows. Good. A little bit in the wrist. Floppy, floppy, pull. Good. Done.
Hell yeah.
Good job.
Yep. Thank you.
So my measurements showed me that you did really well.
Yeah. No, definitely.
Anything you want to say before we close it out?
I mean, I think it's pretty on par with what you expect online. It's like I always thought what the heck it would feel like actually going under the knife right there when you pulled. I was like, damn, that was intense. Yeah.
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 And I tell my patients, because I get a lot of people like you, and like we talked off camera too, you're like my ideal patient because you already did the research on the ring dinger.
Yeah.
You already kind of bought in, know that you want to try it.
Yeah.
And then you found me, right? But I got people coming in that have been ring dinger fans for 5 years, but never had one yet. And I tell them, I don't care if you watch hundreds and hundreds of videos, until you feel it, you don't really know it, right? Is that true?
100% I would agree with that.
Yeah. But you happy?
Yeah.
Because you can't leave till you're happy. That's my policy. Yes. All right, I appreciate that. Well, thanks for coming through and trusting me with your health and your body. If you need more, you're not bad, dude. But this is the best way to do it. So when you feel jammed up again, and I'm your guy, come back for another one.
Of course, yep.
When you feel you need it. So I'm gonna leave it like you're on an as needed basis, meaning when you feel you need me, come back and I'll do my best again. We'll get you released.
All right.
Let's say goodbye to the audience out there. Guru Chiropractor. Big Kyle over here, not a virgin anymore, got his first ring dinger, feeling a lot better, right? A lot looser. If you're watching this and you're relating and you're like, wow, that looks like something I could use that would benefit me, it probably is. It's very relatable visually. And you'd like to come see me, I'm in central New Jersey, Edison, New Jersey. I serve the tri-state area. I even have people flying in now from north Boston, and a couple people driving from Canada and down as far as Maryland. The point is, there's other ring dinger doctors, but there's only about 30 of us around the country. So if you want to check in with me, I could try to find somebody closer to you, but if there's nobody closer to you and you want to take the travels, I will do my very best to help you out. The best way to reach me is go to my website, guruchiropractor.com. All the information's there. There's a lot more information about the ring dinger, about me. There's my hours, my fees are really right there up front. And there's a book now button. Click that button, put your information in. It goes to my assistant. He texts you back. We do texting for onboarding, and you guys work it out. And if you come in and you make it through, I promise you from my heart, I'll work really hard to help you, like I did this guy, get you some relief and get you, on the mend. So, Guru Chiropractor, love everybody out there. God bless. Peace out. Gone.